there's there's a set of questions here, Nicky, which I think are really nice. From a few different patients, I'm on an suppressive treatment for multiple sclerosis, desperate to go and work abroad doing animal research in West Africa. Is this impossible? Someone who's over 80 is asking if they could still travel to remote places. Another person living with cancer who's feeling frightened to travel but desperately wants to see the world now that they've retired. I think a lot of people find this. They've been saving up these trips of a lifetime, or they have a particular travel destination in mind, and then illness hits them and they feel very vulnerable. They're anxious to travel. What would you say to the community of people, some of whom may be listening, about whether patients living with serious illness can travel to remote destinations? I know we've covered some of this.
Yeah. I think that as long as you are aware of the risks and you take precautions to reduce those risks and you talk to an expert and get advice, we can usually help get you to where you want to go. And life is, there's so much more than the four walls for which you live in, and just meeting people, experiencing different cultures, being able to do these things are really enriching. But it's about having the information, planning in advance, making sure that you take any precautions and get any vaccines early, and sometimes can modify the trip slightly. So if there was a yellow fever outbreak and you were unable because of your medical condition to have a yellow fever vaccine, we may be able to advise you of somewhere that you can gain an equally enriching experience, but with some of the anxiety taken away. Does that sound?
I think that's right. I mean, I joined Nicky in this service. Nicky runs the service, and the thing I think that you are amazing at explaining to people is that travel comes with risk. All travel comes with risk when you leave your house in the morning, but not traveling often also, I think, comes with risks. And we often see people who want to travel for a professional reason. They've got a job in a high risk setting, or they're visiting friends or relatives. There's a family emergency and they want to travel. And actually not traveling for those people, staying at home, will make them feel terrible and will limit their lives. And I feel we can't always get rid of all of the risks of traveling, but we often can help people figure out the real risk of them getting yellow fever on that trip for that 2-week period is extremely low, and they shouldn't let that stop them traveling. I feel like that's one of the kind of main things I've learned from you. We are a help you get to your destination clinic rather than here's the list of people that shouldn't travel to this list of places.
Yeah.
Which makes it an inspiring place to